Hello, everyone. This is Dr. Bruce B. Baird, and you're listening to the Productive Dentist Podcast. In this podcast, I will give you everything that I've learned over the last 40 years in dentistry, working with thousands of dentists. I'll tell you, it's not that my way is the only way, it's just one that has worked extremely well for me, and I'd love to share that with you. So you too can enjoy the choices and lifestyle that productivity allows. More time for things you love, increased pay, better team relationships, and lowered stress. Let's get into it with this week's episode of the Productive Dentist Podcast. Welcome to the Productive Dentist Podcast, number 5. We're going to talk today about scheduling. This is Dr. Bruce Baird. Scheduling is one of the most complicated of all the things that we teach at Productive Dentist Academy. And it's the one thing that I think costs dental practices more in long-term revenue than anything else. What do I mean by that? Well, first of all, we teach, and what I teach is scheduling for productivity, not time. Now, most of you are familiar with, it doesn't matter really what kind of software you're using, but in years gone by, I would ask a lot of dentists at programs, how many of you have computers in your treatment rooms? And very few would raise their hands. Now, almost everybody raises their hands. What's important is for you to do your scheduling in the back and schedule for productivity, not time. And let me explain to you what that means. When we start talking about scheduling for productivity and not time, what we're talking about is setting up a schedule that has certain blocks, and many of you are familiar with block scheduling. As a matter of fact, Dentrix, I know because I use Dentrix, but Dentrix has what's called perfect day scheduling. And for years, I would get upset in the office, and I would say, I can't be in two places at one time. What's the deal? Gay, I can't be in two places at one time. Why are you scheduling it this way? As a matter of fact, years ago, back when we had paper schedules, I would be so frustrated by the way things were scheduled. I bought everybody in my entire office a different colored pencil so that when they wrote in the chart, on the schedule, I would know who did it. And I would say, Gay, you can't do this. And she goes, well, I didn't do that. And I said, well, that's your color. And she said, well, somebody stole my pencil. That's how bad it got. And I was stressed all the time. So perfect day scheduling, which is what's taught in dental school if you're taught anything about scheduling, and it's one of the things that consultants across the country teach, this concept of X's and slashes. X being doctor time, slashes being assistant time. It is totally non-productive to use that system. Totally not. It's the worst system you can possibly use, although 95% of all dentists in the country are using that system. I went to a program, I was lecturing up in Canada. This has been probably 15, 18 years ago. And a good buddy of mine, I was talking to him and I said, what do you produce per hour? And this is back when we first started thinking about productivity per hour. And he said, I don't know, let me think. He says, I do about $8.50 an hour. And I said, that's crap. There's no way in the world you're doing $8.50 an hour, because I'm doing $600 an hour and I'm not piddling around. I'm getting in there working, and it doesn't take me a long time to do certain things. I'm running around like a chicken with my head cut off. I'm literally seeing patients all day long, and I'm doing $600 an hour. So $600 an hour, that's what, $4,800 a day, and I'm killing myself. He says he's doing $800, and I was like, no way. So I was lecturing in Springfield, Missouri, and I was with a practice analyst, a guy named Russell Knight. Russell could look at your numbers and know exactly what was going on in your practice, literally by the numbers that he was evaluating, from new patient flow to, productivity. And so I asked him that question. I said, how can this guy do $800 an hour? And he was talking to me, and we were driving from Springfield, Missouri to Chicago because there were thunderstorms, and I was doing a program the next day in Chicago. And I said, how does he do 800? He said, it's easy. He just books $800 an hour procedures. And I was totally stunned. I did not say a word. And for those of you who know me, that's really hard to do, is get me not to say a word. But I didn't say anything for the next hour and a half as we drove into Chicago. I was like, there is no way. And I started thinking, well, how do you do that? And so when I came back to my practice, I began to look at block scheduling, and I don't care what you call it, whether it's you can call it sand, rock, paper, scissors, whatever you hear out there from consultants, and most of us understand what block scheduling is. We need to have at least $2,000 in a 3-hour spot if our goal is $1,000 an hour. Now, the average dentist in the U.S. is doing $405 an hour. So let's just say we want to do $500 an hour. How long does it take you to do? Let's just say you have blocks scheduled. So you have maybe an hour and a half in one chair that's a block, and another chair you have 2 hours. Then you have in the afternoon you have another 2-hour block and another hour and a half block. So you've got these blocks for productive procedures. And you put in, your goal is $500 an hour, and you've got 2 crowns and 2 build-ups to do. Well, if your goal is $500 an hour, and how long does it take you to do 2 crowns and 2 build-ups? At my programs, I've had people say, it takes me 5 minutes, takes me 10, takes me an hour, takes me 2 hours. It doesn't really matter. You just need to know, how long does it take me to do these procedures? Is that really what we're looking for? Well, let me explain to you. If it takes you, let's just say it takes you 1 hour, and the total fee is $2,500 for 2 crowns and 2 build-ups. How much time are you going to schedule? Well, everybody in the room says, well, I'll schedule an hour. I'll schedule an hour and a half. I'll schedule 30 minutes. Because what your schedule ends up being jam-packed with all these procedures. What I'm trying to do in my practice is, if I look and my goal is $500 an hour, and I've got something that's 2,500 hours, in treatment room number 1, or Gay's treatment room, as we've talked about in previous podcasts, she is responsible for that chair. And so I will actually book 5 hours to do 2 crowns and 2 build-ups. Now, people say, that's the stupidest thing I've ever heard of in my life, Bruce. Why would you do that? Well, the reason I do that is because that's my goal. If I set the goal and I said 500, even if I have 3 treatment rooms I'm using, I am actually just booked 5 hours to my goal for that day, meaning I only have 3 hours left to reach my goal of $500 an hour. I wrote a series of articles for dental economics that was called the dental roller coaster. Most dentists, they have a great day one day, bad day the next, great day one day, bad day the next. What we try to teach and what we do in our own practice is we're consistently producing whatever we set as our goal, whether it's $500 an hour, $800 an hour, $1,000 an hour. And I will tell you, I went back, I looked at every procedure I did. If I'm doing a root canal, for instance, and the root canal takes me 2 hours and I'm searching for MB2 and it's $1,000 to do on tooth number 14, and it takes me 2 hours, the most I'm ever going to be able to produce is $500 an hour. But my goal is well above that. So how do I do that? We have to look at the overall. I do that next to that same chair, that has 5 hours scheduled for those 2 crowns and 2 build-ups. Why? Because I know it's not going to take me 2 hours, or it's not going to take me 5 hours to do it. What it's going to do is going to take me, probably 30 to 40 minutes of doctor's time, and that chair is open. Now, next to that, I'm doing endo. I'm not rushed. I'm doing things on time. Now, if I would have only given myself an hour to do that and stuck endo right next to it with perfect day scheduling, what would end up happening is, what happens if you're doing those 2 crowns and 2 build-ups? You have perfect day schedule based upon X's and slashes, and it turns into endo. Well, what happens? Well, now you're behind. Well, you're not only behind, but you're behind. When do you catch up? I know when you're going to catch up. You're going to catch up as you work through lunch. You're going to work through lunch to try to catch up, and you're going to try to do same-day dentistry. You're going to try to do those things. Well, The truth is, most dentists are running so far behind, they never get a chance to do same-day dentistry. They actually end up taking away production off their schedule just so they can catch up. Happens every single day in practice. And so when I look at that and I say, okay, when do I do other what I would call non-productive procedures, meaning a procedure like a composite resin that might be a 4-surface or 5-surface, which I don't do a lot of them, but if I had that, it's going to take me 30 to 40 minutes to do. I'm going to do that next to a block that is to my goal. Does that make sense? I know it probably does. So, but if I'm looking at that, who runs behind? If I'm doing my regular perfect day scheduling and I'm already running behind, who else is running behind? Oh, my hygiene checks. Well, they're all standing outside the room waiting for me to get done. Now their patients are waiting. Now I have an entire waiting room of patients waiting for their hygienist, waiting for me to go check the hygiene patients, and my next patient is waiting. Now, that's pretty stressful. That's pretty stressful. Now, I've been fortunate. This past year, I produced about 3,400 an hour. Now, how do you do that? Well, with implants and with different higher-end type procedures or service mix, I'm able to do that. So if you ask me, and my goal is only 2,300 an hour. When I say 2,300 an hour, that's what, $18,000, $19,000 a day. Can that be done? Well, sure it can be if you're doing the right kind of procedures. But I don't care what you're doing. I don't care if you're doing, inlays, onlays with CEREC, whether you're doing fillings, when you're doing restorations. Set your goals and figure out what doctor time. When you have crowns to do, that may be a huge block. When you have 3 crowns or 4 crowns, that's what you're looking for, those longer procedures that you have no stress. You can pull that down. Let's go back and look at it. Let's say it's those 2 crowns again with the 2 buildups. Now I have 5 hours in gaze chair, treatment chair 1, to do that. First thing in the morning, I'm going to go in and I'm going to anesthetize that patient. I have people ask me, are you going to leave that chair? Are you going to let the patient sit there for 5 hours? I go, hell no, I'm not going to let them sit there for 5 hours. I'm going to walk in, anesthetize the patient. First off, with a buffered anesthetic, I'm going to prep those teeth, and we're going to scan and start making those crowns. And in about an hour, hour and a half, we're finished. I'm going in to seat those crowns. We have pre-cementation x-ray. Everything's ready to go. So all I'm doing is, well, what are you doing the rest of the time? I'm doing every non-productive procedure that I can do in chair 2 and chair 3. Might be a filling, might be incisal composites, it might be whatever it is, taking impressions for a night guard, doing whatever it is. I'm doing that in the operatories or the treatment rooms next to the operatory that I've already reached my goal for the day. So I average increasing my production by about 30% above what is actually on the schedule every day. Most dentists don't do that. Most dentists actually start with 4,000 on the books, get behind, and then end up having to take, well, Bob, we were going to do this upper and lower. Why don't we just do this lower today? Why don't we just do this lower crown today? Does that sound familiar? Because that's what happens. And we run behind, and then we're stressed, and we're looking at all the different things that cause stress in the dental practice. And this is one that's huge. It's how do we schedule? When someone calls to the front desk, and we're going to do several parts for the scheduling, but they call the front desk, and your team up there answers, and they say, "Hi, this is Bruce, and I want to set up for that work that Dr. Baird said that I needed to get done." Well, they have to look it all up. They figure it out, and they say, okay, what we're going to do is you need to have those 2 crowns done. And then they look up at this schedule and they just pick the next available spot. Boom. How about Tuesday? How about Wednesday? And that's what happens. It's not based upon productivity per hour. It's not based upon scheduling for productivity. It's just first available, next available appointment, here you go. And that's why one day you end up doing, 7,000, and the next day you end up doing 3,000. Your productivity per hour, we know that in the past, even though you average at 405 across the country, you've done 1,000 before. You had a big case, so you did 1,000 an hour. Now what you want to do is you want to do more $1,000 an hour days. That's pretty obvious. but you tend to not be able to do that because you're running behind all day. So this is just section one of scheduling, and we may do 4 or 5 of these scheduling sessions just to get you as much information as possible so you can make the right decisions and get off the dental roller coaster so that you can actually produce dentistry at a much higher level, and we'll go from there. We've talked about it in past podcasts, but the way I schedule my assistants is each one of them has a production number, which on Dentrix, I don't know how it is with EagleSoft, but I actually have a production code, which is BBB1, BBB2, BBB3. So I have 3 treatment rooms that the Gay is in BBB1, Shannon's in BBB2, and Summer's in BBB3. And when I book those, who's responsible for that schedule? We've talked about it in the past, but they're individually responsible for their own share, and they do their own confirmations. They confirm their own appointments. Why? Well, if you look at it, I might see 15 people in a day, 18 people in a day. Less is better as far as I'm concerned. I'd love to have a case where it is, say it's 3 implants, and that's $6,000, and my goal, let's just say, is $2,000. I'm going to go ahead and book 3 hours to put those implants in. It's not going to take me 3 hours to do it. But I want my team to be totally responsible for that schedule. Now, I do not pit one assistant against the other on production. What I do is look at all 3 of them together and say, together we're going to do a goal of $2,300 an hour today, or whatever it is. Maybe it's $500 an hour for you. Maybe it's $800. What I can tell you is, with Productive Dentist Academy, we grow productivity substantially based upon scheduling for production. So when I'm looking at that schedule, I already know it's going to be full to my goal. Why? Because I have 3 people working it. Now, what else does my team do? Well, Gay, Summer, and Shannon, when we see a new patient, the doctor sees them first. I see them first. Why? Because I know that we're going to increase productivity by 27% if I see the patient first instead of them going into hygiene first. And people can argue the point. Yes, there are some successful practices out there that see new patients in hygiene. They are the one and done, crown of the year club type offices, and they do very well. They produce bam, bam, bam. My practice is more comprehensive evaluation and treatment plan, which we're going to talk at length about. But that's the type of practice I have. I want to take care of a patient for life. I want to make sure that the dentistry I do has a chance of lasting a lifetime. So when we're scheduling these patients, it's the front office. Maybe they get a call that says, hey, I need to get in for this appointment, like we talked about. It's 2 crowns that Dr. Baird wants to do. They will then put that patient in. They'll look at the schedule the best that they know how. They're not back there every day. They don't know exactly what it is I do. So what I did is I put a system in place that would cover that. And so what happens is they'll say, Bob, what we're going to do is I'm going to schedule you. Would Tuesday afternoon work at 3? Bob says yes. She says, I'm going to put you down with Shannon, or I'm going to put you down with Summer. Why does that patient go with Summer? Because that's Summer's patient. Every patient has a color. It's either Shannon, they're all my patients, but it's either BBB1 color, BBB2, or BBB3. So they said, I'm going to book you with Shannon or book you with Summer, whoever it is, whoever their assistant is. And we've got 3 o'clock on Tuesday, and I'm going to talk to her to make sure that's going to work. So if you hear from her, she may need more time. Is that okay? And the patients always say, oh, sure, that's fine. But I want to get in and get it done as soon as possible. Now she sends an instant message back to Summer saying, hey, I just put Bob in at 3 o'clock on Tuesday. Could you please evaluate that and make sure that's going to be okay? That's the front versus the back. It's not one of these things where they just shove it in there. What ends up happening is then Summer goes, well, I can't believe they put him right here. Who's responsible for that treatment room? Summer. And the communication between the front office and Summer has got to be solid. They send a little instant message. Now, I told you that Summer and Shannon and Gay, they all confirm their own patients. Why? Because they have the long-term relationship with the patient. The patient wants to see them again. So now, what if it's noon and they haven't been able to call and confirm their own appointments for the next day? They'll ask the front desk. They'll send an instant message up front and say, hey guys, we need help confirming my patients. Could you guys help me? And they'll do it. So that's the way that we work our system as far as scheduling. Now, getting back into the scheduling for productivity, not time, think about your goal. Think about your goal. Let's just say your goal is, if you're doing $600 an hour or $650 an hour, you're actually $1 million producer. You're producing $1 million if you're working the average number of hours that a dentist works, which is 1,600 hours a year. So let's look at having a goal of producing $1 million in dentistry. So let's just say that's $600 an hour. So at $600 an hour, look at every procedure that you do in your practice. Figure out how long does it take you to do it, which is kind of counterintuitive, because I'm telling you to figure out how long it takes you to do it, not so that you can schedule it that way. It's so that you know that you're within your production numbers. Let me give you an example. I have a goal of $600 an hour, and I like doing molar endo, okay? And I'm charging $900 or $1,000 for molar endo. And I've got this goal, let's go back to $600 an hour. Well, it takes me an hour to do that endo. Does that fit within my $600 an hour? Well, yeah, it does. $900 in an hour, if you can do the molar endo, you're great. That does fit within a productivity block that you have. But what if that endo takes you an hour and 45 minutes? What if it takes you 2 hours? Now, all of a sudden, you're at a different production per hour. You're at 450 an hour if it's 900 and it takes you 2 hours. You follow what I'm saying? So I'm looking at time based upon how long it actually takes me to do a procedure. Now, truth is, what if I do find, if I'm doing 2 crowns with 2 buildups and I end up finding endo, or there's a pulpal exposure and the decay goes in there. Well, if I've got 4 hours scheduled, I can do the endo. I've got time to do the endo. It's in that chair. I'm anesthetized the patient. I'm doing it. They're already anesthetized, but I end up doing the endo on that tooth. So it allows me additional amount of time to do whatever procedures that I want to do. So I'm custom designing my schedule every day. When I say I am, that's part about being a leader. I hold my team accountable for my schedule. So sometimes I'll hear one of my team members go, "Well, I didn't put that patient there." Well, what do I say? Well, I said, "Yeah, but that really doesn't matter to me. Remember, you're in charge of that schedule. You're in charge of that day. So let's find out who put that in there, and let's go talk to them, and let's kind of guide them on why it wasn't going to work in this spot." So it's constantly this training opportunity that we're working on to help our productivity and to help patients. Because when you're running behind, and trust me, for my first 10 years in practice, the first introduction I had to every patient was, "Hi, my name's Dr. Baird. I'm sorry you had to wait on me so long." That's not a good way of being productive. Instead, I started out, when I came back, Russell Knight was in the car with me. I told you guys, and I said, okay, I want to do 800 an hour. So I started booking 800 an hour type procedures. All of a sudden I was doing 900. Then I was doing 1,000. Then I was doing 1,250. You can play a game with it. And I did. I decided, I was working 4 days a week, 4.5 days a week. I said, for every for every $250 that I increase my productivity, I'm going to take another half day off. Now, I had to do it for 3 months before I would trust that I could do it. And so for the last 14 years, I've worked 2 days a week. Now, how did that happen? Well, I started out at 600 an hour. I ended up at 1,250. Today, I'm over 3,000. I don't see me going to 1 day a week because I still love dentistry. But having a schedule where you're not running behind and your team is being held accountable for that is the way to go. And we've worked with thousands of dentists over the last 15 years of productive dentists. Once they get that concept down, which is, again, a little bit counterintuitive, it's 180 degrees different than what you've been taught by any consultant out there. But what we do is we look at this and we say, it's all about productivity per hour. And how do I do that? Well, it depends on how long it takes you. And rarely does productivity mean doing things faster. It really doesn't mean that. I will use an example. It depends on what you're doing. But if you had 5 teeth that needed to have crowns on them that walked in the door, and it was going to be $5,000, well, how long is it going to take you to do 5 crowns and 5 build-ups? Let's just say it's $6,000. Your goal is $600 an hour, and you have $6,000 worth of treatment. How long are you going to book a treatment room for? Well, you're going to book that treatment room for all day. Now, how long is it really going to take you to do 6 crowns? Well, what if it took you 2 hours? And this is doctor's time only. Great, no big deal. You got another 6 hours. You could do every other non-productive procedure in the other ops that junk up your schedule for Tuesday and Wednesday and Thursday. Move everything you can into that day, because what you're doing is you're eliminating all the other crap that gets you behind. So now you've set yourself up for productivity. You set yourself up to be massively successful without being rushed, without running behind. So our goal is do bigger procedures, do longer procedures if possible. If you're the Crown of the Month Club, it gets very difficult. It's very difficult to, if every Crown of the Year Club, if every year you're going, oh, let's just do 1 crown, bottom line, that's going to be very difficult to be productive that way. And a lot of times, and we'll talk about that in future podcasts, which is the financial strain that patients have that make it very, very difficult for them to do more than 1 crown at a time. And we'll talk about that at length. So if we're looking at production and we're looking at productivity, it's got to be, it's not about speed. It's not about speed. It's about scheduling it correctly. If you give the responsibility to your team and you hold them accountable for that, what you're going to find is what I found over the last 15 years. I show up at the office. I'm ready to go to work. I know my schedule is going to be, I have very few patients that miss their appointments. I have very few reschedules or cancellations or no-shows. It happens so rare. And the reason it happens rarely is because Summer's the one confirming her appointment. Gay's the one confirming her appointment. So the person who's really in charge is the one who's working with them. And if the patient has poor financial arrangements, Gay's going to know. And she's going to say, I just don't have the money right now. Well, let's rework your financial arrangement. Try doing that with your front office trying to do that for you. And now things, you start handing the ball off so many times that you fumble. Well, I don't like that. And remember, I was seeing 300 new patients a month. It was horrible. I mean, yes, we did $1 million, but I only made 32,000. So bad overhead, bad everything. I spent the next 15, 18, 25 years trying to figure out how do I become productive and make more money and take care of more people and do a better job of it. And so, again, productivity is not about speed. You can go to the 1-minute root canal. You can go do that. That's great. But most of us aren't even doing the work on the patients we have because of other reasons. So what I hope that you gain from this information is a new way of practicing, one that gives you the ability to be able to enjoy dentistry and do it on your terms. I look at this as saying, I'm helping Gay, I'm helping Summer, I'm helping Shannon, I'm helping Tamara, I'm helping Kelly, I'm helping everybody in my office, because when pace is great, stress is low, people enjoy being at their practice, they're not running around like a chicken with a head cut off. And people oftentimes say when they come through and we do an over-the-shoulder course at my office, because it's not unusual that I'm doing 20,000, 24,000, 25,000 a day, but I don't run behind and I'm not rushed. Truthfully, it does have to do with the type service mix. We may be doing 8 or 10 veneers. We may be doing 4 implants. So I do those kind of procedures. And how do we get to do those? Well, that's a whole nother conversation about marketing. How do we look at marketing and how do we take care of our patients? So I hope this has been valuable. We'll keep revisiting scheduling. because I know that you have questions, and I want you to go to bruce@productivedentist.com, or not Bruce, just send me an email at bruce@productivedentist, and I will continue to answer these questions. I want this podcast to be something that's interactive with people so that I can help you in the future enjoy dentistry more, make more money, help more people, and have more time. And if you can do those things, you're going to absolutely just love dentistry. So that's the end of episode 6, scheduling part 2, but I know there'll be more scheduling questions, so we're going to continue with that in the future. Hi, this is Dr. Bruce Baird here, and I have a question for you. Do you feel like no matter how hard you try, you can't get off the plateau and to the next level of your business? I get it. It can be incredibly frustrating to work harder and longer and not see any increase in your revenue. But I do have great news for you. Productive Dentist Academy is hosting a productivity workshop on September 22nd through the 24th in Frisco, Texas. So you and your team can come learn the tools and systems you need to get your dental practice to the next level. We've been doing this for 18 years, and it is a course that you really don't want to miss. Come learn for yourself what hundreds of other independent dentists have learned. You can get off the plateau. It's just about knowing what lever to pull when you're in business. To make things a little bit easier for you, if you sign up for the PDA Productivity Workshop during the month of April, we will give you access to PDA Online for free and a 2-hour comprehensive business advisory session so you can start increasing your revenue right now, even before September. Again, sign up for the PDA workshop during the month of April, and you'll get PDA Online and the advisory session at $2,500 value as our free gift to you. So reserve your seat. Go to productivedentist.com/workshop now. That's productivedentist.com/workshop. This workshop is already 50% full for September, so register today to secure your seat. One last time, visit productivedentist.com/workshop. Thank you for joining me for this episode of the Productive Dentist Podcast. If you found this episode helpful, make sure you subscribe. Pass it along to a friend. Give us a like on iTunes and Spotify, or drop me an email at podcast@productivedentist.com. Don't forget to check out other podcasts from the Productive Dentist Academy at productivedentistpodcast.com. Join me again next week for another episode of the Productive Dentist Podcast.